Hi, my name is Joshua Vieira, and today I will be showing you how to insert an intravenous catheter. For short, that is IV catheter. An IV catheter is a direct route into a person's bloodstream via the veins. For the sake of this demonstration, I will be performing an IV catheter insertion into the straw, which will represent my vein, which I will be inserting the IV into. This right here is the IV catheter. This handle holds the needle. Once I take the top off, you will see this pink part right here is the actual catheter. This will be inside of a person's vein, while the needle will be retracted back into the handle here. Things to know about the IV catheter. They come in different varieties. This is one variety. It is a spring-loaded IV catheter. However, there are some that are manual, where you have to manually pull the needle out. And there are also some that come in different sizes. This right here, for instance, comes in a different size. Most IV catheters come in different sizes. The different sizes range from 16 to 18, 20, 22, 24. They go up to about 28. And as you go up in size, up to 28, they actually get tinier and smaller. As you go down in size, down to like 16, you can go all the way down to 12, they get much thicker in size. The advantage for a thicker IV catheter is that from an 18 and below, you can insert blood products into because they are more viscous. And the higher the size of the gauge of needle, the harder it is to push thicker medications or fluids into the catheter. So before you go in and insert a IV catheter, you have to make sure that you have your gloves. You have to glove up and get all of your equipment together. The equipment we will need is the IV catheter, of course, a tourniquet right here, a port or tubing to attach to the pink catheter so that blood will not come out of the catheter when pressure is not applied to the catheter, a ChloraPrep to sterilize the whole site of injection, fluids to check patency. This is normal saline, and you will insert about 3 to 5 cc's of fluid in to check patency of the vessel and make sure that you are in the right position. And then you need your Tegaderm, which is essentially a stickier, thicker saran wrap that you will put onto the site, like so, and it will prevent any bacteria from reaching the site of insertion. So when you're inserting the needle into a vein, which I didn't state before, but you can insert the IVs into hands, into a forearm, into your antecubital fossa, which is the most popular site of injection for an IV catheter. Or you can do it into a foot, or you can do it into a scalp, or wherever you can really get access to a vein. So things to know about the needle before when going into an insertion is you want to have the needle at a 15 to about a 30-degree angle going in, and that's about a 15-degree angle right there going in. You know, go up to a 30 if you need to, and if for a particular patient their vessel is much deeper, you can go up to about a 45, but that is usually pretty rare. Another thing to know about the IV catheter is you always want to have the bevel up. I drew a little diagram here to represent what the bevel is. The tip right here is the bevel. You want to have the bevel up because with the bevel being shaped at an angle right here, as soon as you hit the vessel, the tip, you'll have some flashback into the chamber right behind the IV catheter, which I will show you during the insertion. While the bevel's up is the first thing in, and you always want to make sure that this bevel is up. Okay, So now I'm going to go ahead and demonstrate the IV catheter insertion. This is my vessel right here. And I have decided where I'm going to insert the catheter at. I'm going to go ahead and tie the tourniquet around. And when tying a tourniquet, you want to make sure that you use a quick release knot, which is essentially one loop around like so. Grab this tip right here, tighten it a little bit, make a small loop, go in from above, and just loop it around like so. Tighten a little bit, and boom, you have your knot. Pull this, and the whole thing comes apart. It's a quick release, just in case you need to rapidly remove the tourniquet from someone's arm or hand or wrist or wherever you have the tourniquet at. So we're going to select the vessel we want to insert the catheter into, place the tourniquet around, and once it's tight, the vessel will actually get a little thicker, and you'll be able to visualize it and palpate it easier once the tourniquet's on. Then you're going to get your ChloraPrep. You're going to clean the entire site, not just around the site, the entire area surrounding the site, because we want that whole area to be sterilized and clean. Once we have cleaned the area, you want to let it air dry. Do not blow it, do not fan it, do not pat it down. You want the area around the insertion site to air dry. Once it is dried, we are going to go ahead and begin inserting the catheter. So I've taken the top off the catheter, and I will go in again at a 15-degree angle with my gloves on, and I will go at a smooth motion in. And as soon as I get it in, there'll be a flashback of blood in the chamber right underneath the pink catheter. I don't know if you can see it too well, but that chamber right there, there'll be a flashback of blood. Once I have this flashback, I will keep the needle in the same position, and I will slide the catheter in to the arm, but I will leave the needle in the same position. Without taking the needle all the way out, I'm going to pinch the site above the catheter. Once I've done so, I'm going to click this little white button right here, and it's going to pull the needle into the handle. Once the needle is in the handle, I will put the catheter down, and I will keep pinching right here, because if I do not pinch, blood will come out of the end of the catheter right here. I got my saline. I'm going to go ahead and attach the saline, remove the tourniquet, and inject about 3 to 5 cc's of saline in to check for patency. And as you can see from the tip, the dripping of the straw, I have successfully gotten into the vein. I'll pinch again, twist off the saline, grab my tubing, in this case of the male adapter end, attach it to the catheter, and just twist it on. It should twist on pretty gently, and then I can release the vessel above the site of insertion. Because this tubing right here prevents blood from coming out of the port that I have now created. So once I have accomplished this, I'll get my tegaderm. I will initial and date the tegaderm. Don't know if you can see that. I will initial and date it, and apply the tegaderm over the catheter and the skin surrounding the insertion site, allowing the insertion site to be in the center of the tegaderm. Once you've applied your tegaderm, you have successfully inserted the IV catheter and are now ready to administer fluids, medication, or bloods at will. Thank you.